So today we've been responded to Shikar. Shikar's a 25-year-old male who's had a chief complaint of back injury. He's had a sports injury 2 years ago where he injured his back, and he was seeing a physio for that prior up until about 6 months ago. I think around a week ago he was at gym where he started to feel the back pain again, and he hasn't seen his physio since. Out of 10, Shikar, how would you rate your pain?
Probably a good 4.
4? Sweet. 4 out of 10?
Yeah.
Okay, sweet. We've done a quick vitals check on Shikar, so they're all quite normal. The heart rate was about 60, the rest rate we got was about 13. Got a normal blood pressure of about 130 of 85. Temperature was normal, 36.7. The SpO2 he had was 98%. Did a quick 3 lead, that was fine, and all other vital signs were also normal. Now I'm just going to do a quick assessment of Shikar's back. So Shikar, if I could just get you to turn around facing that side of the couch. Is that alright? Great. Okay, I'm just going to feel the back of your neck. Is it sore down here?
No, not at all.
Okay, just going down here. Is it sore at all?
No.
Okay, what about all here?
Not at all.
Nothing there? Going down?
Nope.
Alright, what about here?
Nope.
Okay, what about the spine around this area?
Yeah.
Okay, sweet. What about the flanks? This side of you get a bit sore?
Yeah.
Alright, if I could see you to roll a little bit more, that's fine. What about this side here?
Yeah,
That's a bit sore?
Yeah.
Okay, am I able to get you on your back?
Yeah, sure.
Super. Okay, is it okay if I just lift your shirt up a little bit? That's okay. So lift it up and just push down your stomach. Is that a bit sore there?
No.
Sweet. What about here?
No.
Down here?
No.
Same with this side?
Yeah, no pain.
No pain? What about here?
No pain.
Here?
No.
Okay, that's fine. Thanks, buddy. Alright, just going down to your feet, mate. If I could just get you to push up with your leg here. Is it sore?
No.
Any tingles there? Would I push them down? Sore?
No.
Alright, same thing with this foot. Just push up for me. Nothing?
Nothing.
Push down for me, mate.
No.
No sort of like sore, you get any tingles?
No, nothing.
Right, okay, what about if I lift your leg up like that?
That's a tiny bit of pain.
Just a bit sore, where's that? Just around here?
Just around there, yeah.
Okay, sweet. And we'll just do this leg as well, mate.
Yeah, same
Just
as the other side.
say right, thanks, mate. Sweet. Okay, that was out of 10 household. Did you say 4?
4, yeah.
Yep. Alright, Shikar. Besides going to the gym, have you had any sort of event after that you might think that's caused your back pain?
No.
Nothing obvious like that?
No.
Alright, that's all good. And if you could describe your pain, how would you describe it?
It's like a pulsating pain.
Right, so it sort of comes and goes, but it's just always there?
Always there, yeah.
Yep, sweet as. Alright, do you have any like medical history, anything like that?
I have asthma.
You have asthma, sweet, that's all good. What about allergies? Do you have any
No,
allergies?
not that I know of.
Not to any medication?
No.
That's all good. Alright, Shikar, so I've just drug checked with my offsider some drugs here. Because what I'm thinking, it is muscular pain,
Yeah.
I would recommend more ibuprofen as well.
Okay.
So I'm going to give you here, I've got 400 milligrams of ibuprofen. I'm also going to get you 500, so that's 2 tablets of ibuprofen. I'm going to give you 1 tablet, that's 500 milligrams of paracetamol. And I'm also going to give you 1 tablet, that's 50 grams tramadol.
Okay.
Alright?
Thank you.
I've got you some water here.
Oh,
Yeah, just come up.
yeah, sure. Sorry.
Sweet. So that's 2 ibuprofens, 1 Panadol, 1 paracetamol, and 1 tramadol.
Thank you.
So that's that for you, mate.
Thank you.
How's that?
Yeah, good.
Sweet. When you start to feel the effects of your medicine wearing off,
Yeah.
you can just read the packet instructions, and I'll leave some here for you.
Okay.
So the paracetamol and the ibuprofen, they should start to wear off around 4 hours, or you can take them every 4 hours, okay, if you just follow the packet instructions.
Yeah.
Leaving you here, well actually taking you to hospital wouldn't be probably the best idea.
Yeah, I don't really want to go to hospital.
Yeah, sweet. And I think it will just be the best for you if you just stay at home.
Yep.
I've prepared for you a lumbar information sheet that might help and give you a bit of information to just read and understand. What I would recommend for you, Shikar,
Yep.
is within the next 12 hours, to go and see your GP.
Okay.
You know, if you need some more pain relief, he can prescribe you some,
Yeah.
maybe Tramadol or something within that range, just to help you out with your pain.
Okay.
I'd also recommend, you know, or he could even refer you to your physio.
Yeah.
You said you went to your physio before. How was that?
That was really good. That was really helpful.
That was all good?
Yeah.
Okay, so yeah, I could also recommend after you go to your GP just to start some rehabilitation with the physio.
Yeah.
Yeah?
No, that'd be
Cool.
good.
Now that we're thinking of leaving Shikai at home, it's important that we go down the checklist of non-traumatic lumbar pain. So going down through the red flags, Shikai has normal bowel and bladder habits. He doesn't have any loss of control. As stated earlier, his temperature is under 38 degrees. He doesn't have any rigors, anything like that. No weird movement, anything. His vital signs were quite normal. Abnormal vital signs is a red flag for non-traumatic lumbar pain. There was no pain in the thoracic cavity or spine, or no pain on the chest, right, Shikar? Nothing like that. Sweet. There wasn't any tenderness among the abdominal area when we palpated. Shikar is able to walk. Earlier he went and got some pre-workout, or what was it? It was some amino acids or something. Yeah, don't really know that stuff, but yeah. He looks quite well. He's got good colour. I can't see that he doesn't really look unwell. And are you feeling quite well, Shikar?
Yeah, I feel
besides the pain?
Yeah, besides the pain, I'm good, yeah.
Oh, sweet as. And he doesn't have pain radiating down both legs, do you, Shikar?
No.
Sweet, it's just towards there?
Yeah.
Alright, because we're leaving you at home, it's important that I go down through my R25 checklist as well. And that's the non-patient transport checklist. So, Shikar, with that, you've been fully assessed, and I'm leaving you with the plan. You can agree?
Yeah.
Alright, so going down with that checklist, so the patient has been fully assessed by me. I've taken a set of vital signs and I've given him a plan, so that's to see the GP and preferably a physio after that, and I've also given him the lumbar information sheet. The second part is to make sure all the vital signs are normal. So we've taken all of his vital signs. Nothing strikes as abnormal. Serious illness or injury has been excluded. Shikar doesn't look seriously ill, nor does he look seriously injured. He's able to mobilize well, get up and go wherever he needs to be. However, he is in just some slight to moderate discomfort, which we've treated for with the pain relief. All the red flags have been cleared, so no red flags are present if the clinical condition is one that contained red flags, so we've just checked that off earlier. And the patient is able to mobilize. Shikar, if you're able to just stand up here for me.
Yeah, sure.
Thanks, mate. And you're just able to walk properly from here? It's just a bit of pain? Sweet,
Yeah.
thanks, mate. You can sit back down. Thanks, mate. Okay. And I've given Shikar an explanation of when to seek further help, so that's his GP, as I mentioned earlier. And after every job, we give a EPRF for every patient. That's just a report form that he can look at, and even the GP might have access to. Yeah. So we've been responded to a 25-year-old male, Shikar. The chief complaint was a severe headache. Shikar said he has a history of migraines and the symptoms feel about the same. Shikar said he'd been feeling the pain at gym. That's when he came home from gym training early. And also he has been feeling quite sensitive to light and quite nauseous with a throbbing headache. So we've just acquired all of Shikar's vital signs. We've got a GCS of 15. A GCS lower than that could indicate an intracerebral hemorrhage. We've got a heart rate of 70, blood pressure of 130 over 85, so he's not hypertensive for his age. We've got a rest rate of 14, SpO2 of 98%, sorry, temperature of 36.6. Temperature of 37.5 degrees could be indicative of meningitis. We've got a pain score of 6 out of 10, and we've got negative for a fast test. A positive fast test could indicate a stroke as well, and all other vital signs are normal. Alright, Shikar, I'm just going to ask you a few more questions about your headache. So when it started, did it happen quite slowly or quite quickly?
Quite slowly.
Okay, sweet. A sudden headache can sudden onset of a headache can indicate subarachnoid hemorrhage, so that's good that it happened quite slowly for Shikar in this case. Was there any vomiting? You said you were quite nauseous?
No, I haven't vomited.
You haven't vomited at all, okay. And I remember you saying it was at the gym when it happened. So I have to ask this. When you were at the gym, were you having any sexual activity?
No.
Okay. Sexual activity can also induce a headache at times, and that's also indicative of a sudden subarachnoid hemorrhage. Are you taking any medications?
No.
Okay. So we can rule out all of the anticoagulant medicines that could cause internal bleeding. Do you by any chance have a family history or any previous bleeding in the brain?
No.
Nothing? Okay, sweet. Do you have any altered sensation in the eye or any scalp sensitivity?
No.
Nothing, okay. So this can indicate temporal arthritis, so it's good that he doesn't have any of that. And there's no sort of trauma to the head that you've had, anything like that? Okay, cool. Alright, Shikar, I'm just going to perform a few physical tests with you, and that's just going to help me understand your migraine a little bit better, okay? Are you able to just look to the left of your shoulder, so that way? Okay, now to your right. Alright, what about down here? Up here? Alright, was there any soreness towards your neck? Will you get any stiffness? Alright, I'm just going to have a quick feel. If you look left and right for me. Okay, that way. Sweet. That wasn't sore for you? Didn't feel stiff or anything? Alright. Neck pain and stiffness can indicate a subarachnoid hemorrhaging or meningitis. The next thing we're going to do, Shikar, is test for your focal neurological signs as well. Okay, so can you tell me the day today?
It's Friday.
Alright, what's the time?
It is 5 o'clock almost.
Yeah, almost 5 o'clock. And what's my name?
Irfaan.
And where are we?
We're at home.
Sweet, that's great. Okay, we're going to do a quick finger-nose test, okay? If you could just put your finger on your nose,
Yeah.
and then just press it onto my finger, and just follow my finger back into your nose. Yeah. Okay. Sweet, that's all good. Now, if you can just follow my finger with your eye.
Yeah.
Alright, awesome. Alright, so if there was a failed focal neurological sign, it could indicate an intracerebral hemorrhage as well. So he's passed all of that, which are also red flags in the CPGs. So opiates are strongly disencouraged for migraine patients. However, I still will offer Shikar some pain relief. I've got some medicine here that I've drug checked with my officer earlier. So I've got 2 tablets of 500 milligram paracetamol, which is a total of 1 gram. I've also got 2 tablets of 200 milligram ibuprofen, which I'll also give Shikar. And for his vomiting, I'll give him 2 tablets of 4 milligram ondansetron. So that's a total of 6 tablets. And here's some water for you, mate.
Thank you.
All good. Shikar, my recommendation for you is that you don't need to go to hospital.
Okay.
So I would recommend that it's best you can probably stay at home. If your symptoms do occur, then I would preferably contact your GP sometime within the next 12 hours.
Okay.
Okay?
Yeah.
I've made an information sheet for you here, so you can have a read for that, and it will just give you some more information regarding migraines and just some general advice that you can look at. And when we leave any patient at home, we go through our R25 checklist. So the first thing is to make sure that the patient is fully assessed, and we've got a full set of vitals. Nothing's within the abnormal ranges. So that's both the first and second. Shikar's not seriously injured. We've done all of our tests. Everything looks all good. All of the red flags have been ruled out. The patient has been seen to mobilize. So Shikar, if I could just get you to walk from here to there, if that's all good. So Shikar's able to walk quite fine. That's all right. Thanks, mate. And Shikar's been given a plan to seek further help, which is the information sheet. And if the pain comes back within the next 12 hours or it's severe, then to contact his GP. And within the pain relief medicine there, Shikar, just to keep on top of that pain, so just to take the paracetamol and ibuprofen every 4 hours, just following packet instructions, all right? And every patient will get an EPRF. Thanks, Shikar.
Thank
All
you.
the best.